Hello and welcome, everybody. Welcome to the episode 7 of Let's Talk Health. We are here to talk about something that is the season's friend today, which is the heat and the heat disorders. And we have none other than Dr. Papa Nadukuduru, Senior Consultant Internal Medicine, to be with us and explain about all the effects and everything that we should know. Heat disorders. So, this is something that we have as our friend right now, which is almost ready and everybody should know about it. So, can you just please tell us what are the basic kind of heat disorders that everybody should be aware of?
Hello. Now, I think summer is at its peak and almost everybody is affected from the heat or its effects or degree of temperature. So, heat disorders basically is a group of diseases. There is a spectrum like from 1 to 5. First, it starts with if you stand for a long time in the sun or exposed for quite long time, the muscles get cramps, the muscles get pains, particularly those who do running, walking or some exercise kind of thing, they get a more of muscle pains. These are called muscle cramps. This is from the again water and some electrolyte loss. Number 2, heat exhaustion. So, somebody can get exhausted usually by evening it happens. Those who are exposed directly or indirectly to the heat, they lose their water and electrolytes, particularly sodium and water. This leads to severe weakness, generalized weakness, and they get undue fatigability. Like normally by evening you can get some little weakness, but it is beyond regular proportion. This is called heat exhaustion. So, you literally get exhausted. Number 3, when you stand for quite long time in the sun, you get some giddiness and some people can fall also. This is called heat syncope. This also can happen because when you stand for a long time, the blood vessels will dilate and you get your BP will slightly drop and you get giddiness and fall. This is heat syncope. Then the fourth one is heat hyperpyrexia. When you are exposed to quite long time, heat, you get your body temperature rises to very high degree, and you lose sweating. Initially you get some sweating, slowly you lose sweating all over the body. So, this is, and you get temperature. This is called heat hyperpyrexia. The temperature will be very high, more than 103 or 4. So, this is a dangerous situation. This is a final warning situation. If this is neglected, we will go into a stage what is called heat stroke, the final and last stage. Once somebody reaches heat stroke, this is very, very dangerous. Many people die because of the heat stroke. And heat stroke is basically, to understand a little, our body has a mechanism to regulate body temperature within normal limits, that is 98.4. So, there is a mechanism in the body. It is regulated by a thermoregulatory center in the brain. So, this thermoregulatory center, irrespective of the ambient temperature, if you go to Himalayas, still your temperature is 98.4, though ambient temperature is very low. And if you go to deserts, the temperature is very high, above 50, still your body maintains the same temperature because of the thermoregulatory system. This is controlled by the center in the brain called thermoregulatory center, and in the periphery by the skin. Skin also plays an important role. It produces sweating and thus it reduces the temperature to near normal temperature. When this system fails, when our body cannot regulate our own temperature, our thermoregulatory center fails because of the high degree of temperature, slowly the person will not have any amount of sweating. You will see a dry, red, hot man. So, there will not be any urine passage, there will not be any sweating. The sweating usually up to hyperpyrexia, you will find some sweating in the axilla. in the axillary fold. But even in axilla, you will not find any sweat in heat stroke, because that the body cannot maintain its only the thermoregulatory center is totally failed. So if that stage is reached, that one should remember that's a medical emergency. These are the various types of heat disorders and the spectrum of heat disorders.
Okay, so now that we know the stages of the different heat strokes, so can we know or can we recognize the early symptoms of this, or if we can get some glimpse of how we can realize that we are nearing the stages?
Sure. One is the exposure itself, how long you are exposed to the heat and the degree of temperature, and what is the ambient humidity. So suppose if somebody is in coastal region, the loss of water will be very, very high because of the high grade of sweating. So if somebody is in cities like Hyderabad, where the humidity is low and the loss of water will be insensible, you will not find like sweating. So when there is high sweating, you lose more of electrolytes as well. So this is important to understand. According to that, there is an index called heat index. So one will lose the water through the sweat according to the heat index of that particular area. Again, it depends upon professions. Certain professions, like who work in the fields, they get more sweating because they are manual laborers. Who are in the loading and unloading jobs, who are exposed to constantly to the heat and high degree of temperature. So they lose a lot of water and electrolytes. And one is exposure to heat itself. Second, it gives us some clues, like you get thirsty. When you lose your water, the body indicates that you are thirsty and you have to take water or liquid. And third is you start getting weakness. You feel like muscle pains, muscle cramps at times. You feel like giddiness. You feel like generalized weakness. These are all the subjective feelings of the patient. So if anyone if they have any of these symptoms, they should get alerted to take the medical help or to understand what it is and how to go about further to prevent what is called the final stage of heat stroke. So these are the initial symptoms. One has to recognize, take the warning signals and approach according to the warning signal. Usually that will stop at that point and it will not go to the stage which is called heat stroke, which is a final and dangerous.
Understood. So are there any particular groups of people who are susceptible to such heat disorders? If so, can we know who they are and why?
Sure, good question. This season is also holidays for children. So usually they tend to play, and because of their over enthusiasm, they don't mind all these primary symptoms of the heat. So they go beyond that and they start having thirsty. Still they ignore because of their enthusiasm towards game, and they get giddiness. Sometimes they fall also. This happens. Some children may get even convulsions, seizures. So small children who are exposed to this is vulnerable. At the same time, elderly above the age of 65, they are also more prone for the heat disorders, and particularly group of people who has kidney disease, liver disease and heart disease, particularly heart failure. All these people, where if they lose water from the body, the blood volume goes low. So if the blood volume is low, they tend to get blood pressure tend to be low. When the blood pressure is low, every part of the body gets involved, like kidneys, other things. So those people who are already having a kidney disease, liver disease or heart disease, they are more vulnerable. And also diabetics, those diabetics, the skin of the diabetes doesn't react in the same way like non-diabetic. So it's called a diabetic dermopathy. So then thermoregulation is little difficult compared to a normal person. So these are the people who are vulnerable sections. Those are extremes of age. Those are having a specific or chronic diseases and chronic skin disorders also. They are the special vulnerable group who has to be careful about.
So now that we have discussed about the different particular groups and all, and also I want to bring this into attention because now in the weeks of summer, is there anything that we can do to prevent this heat disorders?
Perfectly. So to prevent is the best way to prevent a disease is to prevent all the possibilities that can lead to a disease. And one has to, right from morning to evening, one has to plan to do everything not to expose to the heat. Like plan your things to do either before sunrise or after sunset or early hours of the day or later hours of the day when temperature is ambient temperature is a little lighter. And get ready before going out. You have to drink plenty of liquids because this is the one you are losing going to the exposing yourself to the high temperature and heat. You are going to lose water. So take more water before going out, at least 2-3 glasses of water, and carry a bottle of water or buy a mineral water, whatever, whenever it is required. So adequate hydration is the is the bottom line that one should understand. And before going, apply at least 20 to 30 SPF of sunscreen lotion so that you can avoid the sunburns, and you can avoid also tanning, those who want to be beautiful. So after going out, one should carry their umbrella to avoid to have the shade, and the helmet if they are going on biking or two-wheeler, and wherever after going out within at least 30 to 40 minutes, try to take a shade if there is a tree, or if there is a nearby air conditioned mall or theater or coffee shop or a hotel. Wait for some time, get better yourself, and then you can continue with your work. That's how you should plan your day, your work, and take adequate sunglasses so that your eyes will not be affected from the sun. And you can drink about any kind of fluids like water, juice, buttermilk, any of these are acceptable. And you have to avoid some more things are there, some things you have to avoid. These things are mainly the aerated beverages like cola drinks, Coca-Cola, Thumbs Up, Limca, etc. And also beer. You find a lot of, in the hot summer, cold beer is available like usual. But this should be avoided by all means because the body is asking for water, and you are giving a fluid which is much thicker than water, so that it goes into the body and takes whatever the water is there inside, you get further dehydrated. So avoid all these drinks, mainly alcoholic drinks and the cool drinks. Okay, and you have to better to avoid spicy foods to the extent possible. Okay, so this is how you have to prepare yourself to prevent these heat disorders.
Understood. Out of all this, should be very helpful for people in and around because of the season. So now that we know how to prevent, and this is going to be really useful for us, but something that we all like to know, because we might experience this, or people around us might experience this. What is the first aid, or what is the first go-to option for somebody, for us to do to ourselves or for people around us when they face a situation of dehydration or heat exhaustion?
Some most important question. So when there is an exposure to a ominous substance or to very high degree of heat, first take them out of the heat area. So if most of the people who get exposed to this is those who are working in the fields, those who are working in the manual laborers, etc. So they should stop that and they should be taken to a shade area, particularly if there is a tree, proper tree. And what is missing is liquids are going out of the body. So you have to give them as many liquids as possible to drink so that they get slowly. Why all these symptoms comes when the person is losing water, the blood pressure starts going down because of blood volume is lost. So at this point give them the liquids as slowly as much as possible over a period of time continuously. This is rehydration. Rehydration should continue till they get adequate amount of urine. This is important. So immediately what we have to do is take them out to the shade or an AC area or a place where there is adequate low temperature, and then you can put some water, spray on water if the sprayer is available, otherwise just sprinkle some water. And if it is at roadside or somewhere, you can take with fans, or if fans are available, or take a book and try to give some fanning to the patient, then slowly the temperature goes down. So giving adequate liquids and see that there is a free aeration to the patient so that the temperature tries to goes down. So this is the immediate thing. And then try to give along with water, they lose what is called electrolytes, mostly sodium, potassium, sometimes you need bicarbonate also. So simple sodium, potassium, you can supplement by giving juices, okay, by giving salt with buttermilk or just any fruit juice with salt, that will also adequately. Most of the times the muscle cramps are from low sodium. So one has to give sodium. If possible, if things are available, you can give even oral rehydration solution, where the rehydration ORS packets are available everywhere and it is free in every government hospital. So one can take, just mix with water and try to drink as much. So this will relieve the immediate symptoms.
Understood. Apart from dehydration,
In case they went to the stage 3 or stage 4, like very high fever, or the more or less the treatment is the same. If they are semi-conscious or subconscious or in coma sometimes you find they are in fits. So such patients you should not give oral fluids, because this inadvertently it may go into the lungs and it can cause problems and further infections and so on. So in a conscious patient you can do all this. In a unconscious patient, try to cool him down, put cold cloths over there, keep cold water running over the body and keep fanning the patient, and try to take to the nearest hospital as early as possible.
understood. So apart from dehydration that we discussed during the stages of heat disorders in the beginning, what is the best time that one has to reach for medical help throughout the heat process? When do you think is the right process or right time that this is the right time when the patient has to reach for medical help so that this can be cured?
Sure. So this is important. Heat stroke, as I told, is a serious disease. There are many deaths from heat stroke at this point. So to prevent that stage, one has to take all the preventive measures. If they are not possible, try to drink as much fluids as possible. If that's not possible, they will reach to first, second or third stage, where you can try to support them and try to give him more fluids, more electrolytes, so that they come out of and get reversed. If fourth and fifth stage, like heat hyperpyrexia, and the last is the heat stroke, these are the two dangerous situations. So you have to realize that if the patient is getting semi-conscious, if the patient is not able to stand, and if there is no sweating even in the axilla, and you find a very red hot man, this is the situation where you have to see that he is in danger and try to ask for help or call for an ambulance as quickly as possible to reach the nearest emergency center.
Understood. Is there any other things or any other points that you would like to add for our audience to know that these are the basic awareness facts that they should know in spite of everything that we mentioned before?
So heat stroke is something 100% preventable. When 100% preventable, nobody should die of heat stroke. This should be everybody's motto, and everybody should understand these simple measures. You need not have very complicated measures. These simple measures. Sometimes we overlook these measures. For example, if we go in a car to a mall, if you keep the children in the car inside the car temperature rises very quickly. Should never do that. Take the children with you. Okay, there are many casualties happened because of that. Should never leave a child in the car. Try to give them, even the ambient temperature is high, even you are going in a car, try to give them more liquids. And these vulnerable sections like extreme ages, those who have heart disease, kidney disease, liver disease, and those who are taking diuretics, certain medications to lose water from the body, such people are at even more risk because there is a narrow range of safety for them. So they must by all means avoid going into the sun or getting exposed to sun. If they cannot, if they have to do because of some urgent work, they have to take all the precautions. Okay, and another important thing is water should be freely available everywhere. There are many NGOs also, non-governmental organizations, they distribute water packets, water bottles, and also buttermilk. They should take use of that and drink as much. Usually we are afraid of infections when you go out, but buttermilk usually doesn't carry infections. That is one important thing. And one should, as I said earlier, this is 100% preventable. So one has to just be little cautious about, and try to, if there is anybody needs help, try to help them out so that a serious situation can be prevented. Thank you.
Thank you so much, sir. I think the facts and the discussions that we had is going to be beneficial for a lot of people out there, considering the season is also supporting our topic today. So thank you very much for your time and energy, so that for the well-being of a lot of people. We'll see you again in the episode 8 of Let's Talk Health. Today, take care of yourselves. Beware of the heat.
Thank you.
That's it for today. We'll see you again on episode 8, Let's Talk Health. If there is any questions for our consultants and us, you can always drop a question in the comment box and we'll get back to you on the same. Every Friday, 4 p.m., we'll catch you back. Beware of the heat.